Well, what I do is public relations, provider relations, and I go to different facilities. I meet with different churches, doctors' offices, social workers, family members, and talk to them and discuss hospice care and palliative care for Crossroads. Well, what I wish they would really know is that, when you talk about hospice, a lot of people, especially when you're talking to family members or just lay people out in the community, oh no, I don't need hospice. I'm not ready for hospice. And they think it as a death wish, and it's not. It's just, I discuss with them, it's just a way that you can decide how you want to live the end of your life. It's just not about death and dying, because there's a whole lot to go with it. Your spiritual counseling, your communication, your memories, your loved ones. We take care of the whole family, not just the hospice person. And a lot of times people see the hospice word as something dark, and it's really not. It can be a beautiful thing at the end of someone's life. Not so rushed in the hospital, it's like doctors and nurses. But when you're at home, if you decide to have it at home, you have your family there, you have all your loved ones, you can be able to talk, tell them how you feel, and be surrounded by love and not by strangers. So I think that's what's very important. It was a hospice case of a young girl. She was probably like 10 or 11, and she was on hospice care where I worked. And her family really didn't know at first what hospice was about, didn't know how to handle it, but we stepped in as a hospice organization and helped the family, not only the child, but also all her siblings, as well as her family members, her grandmother, her grandfather, and everybody was there and able to, participate. They did memories. We did a memory board for her, and each child wrote a story about their sister, what they thought was like the best day of their life with their sister. And even on her last day, you all knew that she was going to pass, but it was a warm feeling and it was a happy feeling. There was tears, of course, but everybody was like happy because they were able to communicate and connect with this child before she passed away. And I thought that was like the best. This is a great place to work, and it's a great place to bring your family if you need some help. You don't have to do it alone.